are down to agenda item number 6, which is our COVID-19 update.
Good afternoon, Mayor and Council. Shannon Anderson, Deputy City Manager. I also have with us today Dr. Engelthaler. So we will turn it over to him first to be able to share his slides as well as an update for Council on our COVID situation. Thank you, Dr. Engelthaler, for being here today.
Thank you, Shannon. And good afternoon, Mayor, Vice Mayor, and City Council. Glad to be here today and to be able to kind of give you an update as to where things are at. So I will show slides. I'll try to go through them pretty fast, but I want you guys to see the latest and greatest what we know primarily about Omicron, and then happy to answer any questions after that. So we'll open this up, and I hope that looks all right. And please let me know, Shannon, if something goes awry.
Well, looks good on our end. Thanks.
Good. Thank you, Mayor. All right, so Omicron. So we're going to talk about black clouds and silver linings, because there are some silver linings, and obviously the silver linings of those cross-country racers that were just up there. Congrats to them. I have a couple of cross-country runners in my family, and I know what hard work they do. So big congratulations. And they might be the only thing in town that could outrun Omicron, and that's kind of a prelude into what we're going to talk about, is really how quickly Omicron moves and how important it is to understand the full landscape around this particular variant. So let's just start off with where this all began, which was Thanksgiving 2021. That's actually when most of the world essentially found out that in South Africa, where the officials there alerted us that they had a new variant that was just rapidly spreading in the region, to a point that it really alarmed them, and they wanted the world to know about it. It seemed to outcompete Delta, occurring in some of the most populous regions in South Africa, including Johannesburg. It was spreading faster than Delta at that time, so it was not only seemed to be replacing Delta, but it was just infecting households and communities so much faster. It seemed to evade some immunity from vaccines that they were having locally. They have the AstraZeneca vaccine, which was not working well at all, but even the mRNA vaccines were not perfect against this. And it was infecting younger populations, not necessarily children as much as just younger adults than what they had been seeing with Delta. And it also seemed to be causing milder illness overall. So that's what they knew. They let the world know about that, and the world promptly then banned travel from South Africa to try to stop the spread of this new variant. Now fast forward to about 6.5 weeks later, Omicron is everywhere. Omicron moved way faster than travel bans could be put in place, which was no surprise. In fact, it had probably already spread to most continents by the time countries were deciding to ban travel from South Africa. It is now found on every continent, including Antarctica. It has been found at a research station in Antarctica. And so this has moved faster now than any other variant to date, and faster than anything that's ever moved around the globe that we can fathom. And I'm not just talking about then SARS-CoV-2, but any pathogen, any outbreak. This variant is the winner of all that for sure. It is now in 110 countries, likely will be seen in most all countries within the next several weeks. And the graph on the right-hand side, this is what we call the epi curve, looking at cases globally since the beginning of the pandemic. And right on the very right-hand side of that sharp needle spike straight up is the signature of Omicron. This is what Omicron looks like. As you'll see, it's what it's looked like. Every place it showed up is a incredibly exponential growth straight up, unlike any of the variants that we had seen before. If we look in the US, this is now where all the hotspots are in the US. We're starting to see most of that red area be mostly in the orange and yellow for getting into Thanksgiving, but then soon thereafter, it all turned this dark red, almost looking like a purple. and is really spreading quickly, primarily in the eastern United States. But you can see it has been found in all 50 states in the U.S., Puerto Rico, other territories as well. And again, on the right-hand side is that needle spike straight up when Omicron showed up, just like it was seen, it has been seen globally. So to try to understand how this may be hitting us, let's look at how it's hitting some other locales. So South Africa, the most important place where we've learned about this from, they've actually, you can see on the left-hand side, you can see that there is a really sharp spike and essentially an immediate drop down. And this is hopefully what we're going to see in other places. It is starting to show itself in some other European countries, that it's starting to drop off pretty quickly as well. So about a 30 to 45 day span probably for the length of the outbreak or the spike from Omicron, which is great. It's very short. Hopefully going to be very short-lived. Most places it shows up. We'll have to see about that. But maybe one of the more important things to look at too is that what we don't see is any kind of a spiking up in deaths. Over there on the right-hand side, it has been several weeks since the spike up, and there's not been any deaths really to speak of because of this, other than we could see this little bit of a blip, and that might continue to grow a little bit. But it seems to be following along with what they originally said about how most cases they're seeing, the vast majority of all cases, are really mild, do not require hospitalizations, and even those that do typically are very short stays in the hospitals. So that is good news. Let's go ahead and look at the this is the only other place. I won't show you everywhere, but the UK has had a really tremendous spike in cases as well. Theirs started earlier than ours did. They may be getting close to the top of the peak of the curve. We don't know yet, but there are some indications from the UK that they're in some areas of the UK, they're starting to see drop off in cases, which is good news, and hopefully it follows the South African pattern. And again, on the right-hand side, what we see then is really just a complete flat fatality curve, really for the last several months in the UK. So while they're going to have additional deaths because of Omicron, just because of the sheer enormity of the cases, they're not seeing it really register anywhere near what was going on with the previous peaks. Now look at those peaks, and now look at the peaks in the cases. This was their, over December 11th, in the blue here, was their massive winter surge last year. And compare that to what they're seeing now, it just looks like a speed bump. That is how much effect this is having in a country that has very high vaccination rates and overall immunity rates, because they've had a lot of cases in the past too. But they're still getting this enormous wave of cases. I think that means that's exactly what we're going to see, and that's actually what we're starting to see in the U.S. If we look at some of the states on the East Coast, New York down to Florida, we can see again this signature of Omicron. The dotted lines represent a comparison to the last winter peak. If we see here 100%, this would be equal to the last winter peak. This in New York, they're well over 400, getting on 500%, so 5 times the number of cases as during the last winter peak. New Jersey, the same thing, over 400. Massachusetts getting up to 300, Florida 300, and these numbers then will continue up till they hit that peak and then hopefully drop down suddenly. So in Arizona, we know we're seeing a lot more cases. And it really feels like this is what's happening in Arizona. But look where we are in Arizona. We are just barely above our peak from last year, and maybe just at the beginning of this spike like these other places had. And maybe and likely we will see a very similar effect. We've had a lot more cases recently in Arizona over the last few months than a lot of other places have had. So there's a lot more relatively newly developed immunity, so maybe it won't be as bad, but I think that this is what we should prepare for and think about. And this is not just Arizona. We can see New Mexico is on the same trajectory right now as us, and they're starting to spike straight up. If we get a little bit closer into the Arizona numbers, this is the Arizona curve. Actually, let's look at Coconino County. We can see in Coconino County, we really are up past the peak of where we were last winter during the surge, and which is not surprising. We've been having a lot of cases showing up in Coconino. We've been hearing about it, and we know a lot of that is Omicron. If we look at the variant surveillance, and variant surveillance is usually lagged by a couple of weeks, so we only really have good data going back to the week of December 25th. But we can see the first week of December, we didn't have any Omicron. Everything else blue here is Delta. Omicron is in red and maroon. Then by the next week, a handful of cases, and then growing. So now it's over 50% cases in Arizona are Omicron. And that's going back to the week of December 25th. It is likely much more than that. And this is just that data. This is pretty much showing the same thing. These are the weeks of the month, and we could see the proportion of Omicron within the overall genomes that have been sequenced. Now, of course, we're only doing a subsampling of cases, but we're seeing that same trend that we're have seen elsewhere around the country and the world. So it's fitting in line. And then if we look at counties right now, so this is total genomes for the month, 32% for all of December. But if we just look in those last 2 weeks, we're really seeing about almost 74, almost 75% of the genomes that have been sequenced in Coconino County are Omicron. Again, this is a much smaller overall total number than we would typically see, just because the sequencing has to catch up. Delays over the holidays and COVID illnesses, I'm sure, are affecting all the labs that are working on this. But it is Coconino County, Maricopa County, where we're certainly seeing quite a bit of it. My guess is it's a bit more widespread than this. We just haven't sampled enough yet. So why is Omicron so different? Well, we've been hearing a lot about this and hearing a lot about all these new mutations that have occurred, and that's exactly what it is. I won't go too far into this, but what's really important is when we get mutations in that spike protein. You remember the spikes on the outside of the virus. It's the tops of those spikes that interact with the human cell receptor. So that's where the virus can get to and get inside of the human cell. And so if the top of that spike changes a little bit, it can change how it interacts with the human cell. And so a lot of changes will make the virus less likely to enter cells and then cause more replication. We've seen other variants in the past get mutations in this spot that have actually helped increase the speed of replication and increase transmission, as well as increase potential escape from antibody. And we're seeing that essentially times 10 with Omicron. All the yellow that we see here on the top of that spike protein, those represent new changes occurring from just this one variant. And here's kind of a side view of the spike protein. If we look at Delta, all the red spots here represent the mutation. So we knew Delta had a lot of mutations in the spike protein. But if we compare that to all the red spots here in Omicron, it pales in comparison. Omicron really is a different beast. There's a lot of changes in here. And it's not just in that spike protein. Sorry about all of this data, but this is just what we're seeing as a cartoon picture of the whole genome of the virus. And in green here, if you can see that represents the spike gene. It's one of the more important genes. But every one of these lines coming off, these are all new mutations. So we're seeing mutations throughout this, and each of those may have an effect on this. So we know that some of the mutations in the spike protein absolutely have prevent antibody from binding to it, so then the virus is more easily attaches to human cells. Some have allowed for easier entry into the human cells, and some mutations have allowed for faster replication once inside human cells. This whole combination is really this perfect storm of a virus that can replicate, get inside, replicate faster, and now get out faster. But we're continuing to learn more and more. The latest research that's come out, and I've just compiled some of the summary notes from what we're learning on a day-by-day basis in studies that have come out in the last couple of weeks, the Omicron virus not only does those things I was just talking about, but it prefers the upper airway, the bronchus cells to infect rather than the lower airway down deep in the lung epithelial cells. Now, this is important and probably why we keep hearing about more mild illness. The virus likes to be in the upper respiratory. It gets in, then can replicate faster in those cells and get out. That's why we have very short incubation periods, and we have a lot more transmission occurring, but also maybe a lot more mild outcomes from this. And study after study, multiple studies now out of South Africa and out of the UK have shown that we're seeing on the epidemiologic level significant decreases in hospitalizations, decreases in severity of illness, and decreases in death overall. Omicron does evade antibodies from vaccination, really evades antibodies that were generated from the J&J vaccine, more so than the mRNA, but even from the mRNA. So we have a less effective vaccine, probably down to an effectiveness of vaccine efficacy of 70% from someone who's been recently vaccinated. Versus what we were seeing before, like 93%. So 70% in preventing someone from getting an infection. But we do know that the boosters then are getting people really bounced way up high in their circulating antibody to be able to respond to this. And we also know that Omicron provides good protection against Delta, whereas the Omicron immunity, the immunity we get from Delta isn't providing as much protection against Omicron, but this is one of the reasons why Omicron is replacing Delta wherever it shows up, is that then the immunity that you get from that, you can't get a reinfection, or you don't get a reinfection from Delta, or at least not as easily. So it's kind of warding off Delta as well, and hopefully that'll continue. And then Omicron does not evade the T-cell immunity that is gained from either vaccines or previous infections. This is another reason why we're not seeing very many deaths overall and less severe cases, because even though you get that breakthrough infection, once your T cells kick in, those are the ones that go in and destroy the cells that are infected with virus, and that seems to be working really, really well. And again, so it's not all is lost with our vaccinations. It's really still going to protect us from getting serious illness. We're just going to see a lot more breakthrough infections. So let me just kind of wrap it up. One more note. Omicron also seems to be milder in children. This is some research coming out of Children's Hospital of Philadelphia, but we're also seeing it in other places as well, where children are, although we're getting more and more positive kids, and that's partially because this virus just moves so fast and easily infects the upper airway of pretty much all humans right now. We're not seeing serious outcomes, and it's likely because it still doesn't get down deep into the respiratory tract, down into the lung cells. So just to kind of wrap up the black cloud and the silver lining again. So Omicron is quickly taking over as the dominant variant. My guess is it is in most parts of the state already. It will roll across us. It will literally roll across us like a tidal wave. We've seen those spikes, how incredible they are everywhere it's shown up, but then it will likely roll right back out again, and it'll be a short-lived situation, and maybe the span of that is 30 to 45 days. Omicron is not going to be stopped by all of our previous vaccinations or previous infections that have been over 6 months ago. We get a drop off of antibody anyways after about 6 to 9 months, but then those antibodies that are remaining are seemingly less effective. But our immunity that we gain from either previous infection or vaccination really does prevent serious illness and deaths. And Omicron in and of itself will likely lead to mostly mild and asymptomatic cases. So we're going to see the numbers, as I mentioned, just go off the charts when we're just looking at cases as a statistic. But that doesn't mean that we're actually at any greater risk because of it. We can lower Omicron spread by getting boosters, still encourage that. for people, especially that it's been 6 to 9 months since they've been vaccinated. Now's a good time. It may be too late because you may get exposed to Omicron before that booster really kicks in, but it'll be working in concert and probably still provide some protection. We need to ensure, though, still that the highest at risk are highly immunized. And I think for the next month to month and a half, they need to be somewhat isolated. I think that as this rolls through, the best thing they can do is essentially not be going into crowded places as maybe they got comfortable because they got vaccinated. If you're at high risk, if you're over 75, or if you're immune suppressed, I would recommend not spending a lot of time outside the home with strangers or in crowded places, and really just try to weather the storm, which I think will be a pretty quick storm. And then I think we all, though, need, as from community leaders and elected officials to business owners to teachers and administrators to students and employees, that we just need to psychologically and socially accept that this is going to happen, because it's going to happen, and it will cause lots of cases. But in the end, this may actually be a good thing, if there could be a good thing from this, that it does allow us to get closer to that endemic state. We'll have a lot more immunity in the community. We will not have the terrible effects that we did from Delta and some of the previous variants. And so that is just something that we just kind of ready ourselves for. And by the time we put in too many things to try to prevent it, it'll probably have already left the building, and that's a good thing as well. So that's my update, my take on where it is, as well as the latest science. And I am happy to. I got to turn this back over. My apologies. There we go. Should be able to stop sharing. There we go. So happy to answer questions, Mr. Mayor and Council, whatever you guys like.
Thank you so much, Dr. Engelthaler. That's extremely informative, but definitely want to open it up for questions from members of council. I do have a couple myself, but I'm not seeing anything in the chat at this. Oh, Councilmember Shimoni and then Councilmember Sweet. Sorry.
Thank you, Mayor and Dr. Engelthaler. Welcome. Happy 2022. Thank you for joining us this evening and sharing your expertise with the community and with us. Very informative and helpful presentation. I learned a lot, and I really appreciate your time. I do have a few questions and concerns. When you show that national map, Flagstaff with the different shades of red and yellow, Flagstaff was definitely one of those purple spots, it seemed like, or dark red spots in northern Arizona in general. So we are getting hit hard, is what it seems like from that map's perspective. And knowing that the worst is yet to come significantly, if I understood your presentation, it's going to get pretty bad for about 30 to 45 days. What do we do that, what can the community do to slow that spread and protect our community from that? Thinking about our hospital capacity, already being pretty full as it is today. But yeah, understanding that the death rate is flat and likely will remain flat, which is great news. But is it, wearing N95s or KN95s? Is it continuing to promote the boosters? Like you said, the booster might take time, but it'll take less than 45 days, right? So there is some value. I think we still have some time, council, in the city to really promote some good messaging right now. So what would you recommend that messaging be, in regards to practices? Like, is it a particular mask? And then, anything else other than promoting the booster and vaccination?
Yeah, great. Thank you, Mr. Mayor and Councilmember Shimoni and the rest of council. I think that this is the one that everybody's struggling with, because it's really hard to figure out what do we do different. And honestly, I just think that maybe the biggest thing is just to continue and use this as an opportunity to continue to point out that everything that we're doing is really got to be in to try to limit the worst of the outcomes, and that is what would be the deaths and the serious outcomes. We don't want to be obviously overloading our hospitals. So we want to continue to do those things that we've been learning. We can't really do much more other than just get immunized. I was actually 2 months ago, I was really pushing the boosters for individuals who are in the higher risk categories, specifically those over 65, anybody who's immune suppressed or has any other high risk condition. I actually, because of how fast this has moved, I've been saying now for the last month that I really do think that getting a booster for everybody is a good idea. Getting vaccinated is great. Getting a booster is a really good idea because our immunity levels have dropped off if you got vaccinated over 6 months ago. And this is a really good reminder to do that. And I didn't want to make it sound like it is too late, because it's not too late. I do encourage people to get their boosters. That'll help prevent them from getting that Omicron cold that it's being called. And some people, it'll lay them on their back for a day or two or maybe longer. Many other people won't even know they have it. But it's better to get the booster, and then maybe we get exposed to it in the community, and you'll be able to deal with it just fine, and also continue to reboost yourself. And that's how we get to, I mentioned this endemic state. That's how we get to a place where, okay, we've seen this now. We're probably going to be strong for another year, and then we'll get a booster again before before winter rolls around next year. I think for families in the community, I really think that they really do need to be thinking about their at-risk loved ones and do what's necessary around them, not only ensuring they're immunized, but then doing the safe things. Maybe the whole family doesn't go out and do extra exposure things, going to large parties or to concerts or whatever that is. And if you have kids and high-risk people in the household, and the vaccines are available for the kids now, and I think it's really worthwhile if you have somebody at high risk in your family. But I also want to say, let's temper that just a little bit with this is the variant we wanted, right? If any other variant, we couldn't have come up with a better one so far that we're thinking of. But it's still a variant. It's still SARS-CoV-2, but it's at least, if it all continues to hold true like it has for the last several weeks, it's the milder one, the one that we can deal with and get through and get more to this endemic phase. So I hope that helps answer that question.
It does. And I'm actually going to turn my camera off for bandwidth purposes, but can you just speak briefly to the different kinds of masks? There's a lot of information being put out about some masks being more effective than others.
Yeah, thank you. Sorry, I meant to add that into that. So the mask question has been, it's been interesting because the further we got away from that original strain of this virus, the less and less protective masks have been. Our N95 masks, if properly fitted, still work really well, and they're doing exactly what they want. And so that's the ultimate. But you don't want to wear those around, for hours on end. Physicians and nurses hate wearing those things for long periods of time, but they're trained on how to use it. For the most of the rest of us, those KN95s, which are kind of the knockoff version of that, they still provide then the next level of protection. Just make sure it's tight around the face when wearing it. Next after that, it's going to be the procedure mask, the hospital kind of grade masks that are become very common. Those are providing probably less and less overall protection than they were before, but there's still some protection there. Then you get down to the cloth masks, the homemade masks. You're just getting further and further away from actually having real protection from a mask. So I do think that masks should be worn probably definitely where there's large numbers of people and people interacting that don't live together on a fairly close basis, that close contact. I do think that because it just provides a little bit of protection, or if you have the KN95s, you have a lot more protection by wearing those.
That's great. Okay, and last question for now. How long of an exposure would you say Omicron needs before it can be transmitted? I'm sure it depends on, load, viral load and such, but is this like within seconds or is it within half a minute? What are you thinking?
So this is a great question, which we don't have an answer for right now, given the fact that people get really, they still get the very high viral loads, that the incubation periods are shorter, that people seem to transmit to more people. The thought is that they're probably transmitting out more virus, and it's really more of a dose response. The more viral particles you're exposed to, the more likely you are to get infected. With Delta and with previous variants, that one's really been exposed. We've been looking at chunks of 5-minute times of being in within 6 feet of somebody who's 6 to 10 feet of somebody who's infected. But my guess is that it's probably much shorter than that because there's more virus potentially being coughed out by an infected individual. So it could just be a matter of minutes. But we don't have the data on that yet. Councilmember Tony.
Great. Thank you so much. Thank you, Mayor and Council. I appreciate it.
Thank you, Councilmember. Thank you, Dr. Engelthaler. Councilmember Sweet.
Thank you. Thank you for the information. Great to see you. Looking through this through the lens of a small business owner, do you have any other recommendations that either restaurants or retail, et cetera, could be doing right now?
Yeah, great question. So Mayor, Councilmember Sweet, rest of council, I think that unfortunately businesses are still stuck in the same spot that they've been through this whole pandemic is what do we do? How do we react to this information? How do we protect our customers and our employees? I really think that it's very useful for all business owners to recognize that this virus is going to be spreading in their businesses, going to be spread by customers, will be spread by employees, and they won't even know it. And many of them won't even know that they got it. And so that's one part of it. But the other part of it is that they can lower that amount of spread by really encouraging vaccinations among their employees, but also to their customers, saying that we're all in this together, trying to do what's right. Hopefully, you've all been vaccinated. Whether or not they mandate masks or not, I think has a more limited effect. But I think that mandating masks for individuals who haven't been vaccinated, because they're at least now there's some level of protection. I think it's just more reinforcing a lot of that same messaging as before, Councilmember Sweet. And I know with some with very small kind of stores where people are kind of packed in, maybe just kind of doing as much as possible to limit how many people are per square foot overall, and that might be limiting the amount that can come into the store at any one time. A lot of places did that during last winter surge, and you don't want to leave any customers standing out in the cold for sure, but you don't want to pack them in because it's nice and warm in your store and it's cold outside either, because then that just will be a nice hotbed for transmission.
Thank you.
Thank you, Councilmember. So my question regarding the at-home testing, I had read, but I hadn't seen any scientific evidence about the possibility that the at-home tests were less effective in detecting Omicron compared to other variants. Is there any scientific evidence on that, or is this something that is just a hypothetical at this point?
That's a good question. There's actually some layers to that, Mayor and Council. The specificity and sensitivity of detecting and identifying the target that it's looking for is still the same. So that if you have virus present in a sample, those at-home tests they're not as good as PCR tests. There's no doubt. They're not as sensitive as PCR tests. And that's okay, because the PCR test will detect viral fragments for many days and sometimes weeks, and people aren't infectious during that period. It's identifying right up front. And when people have a higher viral load, which they seem to have with Omicron, you're more likely to get a positive on those at-home tests. However, what we don't know yet is enough about the molecular biology as it infects a person, meaning that do we have equal kind of infection in the total upper respiratory airway like we would do with Delta, so that if you got the really long nasopharyngeal swab, just the nasal swab right inside the nose, or an oral swab or saliva, all of those were pretty equivalent. We don't know that that's the case yet, and it does depend potentially on how the sample's collected. We're going to learn more. I don't have much to tell you there yet, although we do know a lot of those are coming up positive for Omicron, so it's working when in a lot of cases. And that doesn't give us a good scientific answer, but there is a possibility that there may be some difference on how prevalent the virus is in different parts of the body, which could affect how a sample is collected and then tested.
Okay, thank you. The other question I have a little related to that, well, not as related, but regarding the vaccines, and not to get too scientific, but I'm just wondering why exactly is the J&J versus the mRNA vaccines so much different with this particular variant?
I think it has a lot to do, Mr. Mayor, with the way that the vaccines have reacted to us, even with the other variants. So when we get a vaccine, the mRNA vaccine, we get this ridiculously sky-high level of antibody as we're also developing our cellular immunity. And that antibody level then starts to drop off. And then by about 9 months, it's down at a level where it really allowed for more breakthrough infections. And this was with Delta. The J&J was similar, but we never got anywhere near the levels of antibody to start off with. And then those dropped off pretty quickly. What we're seeing is if you're not starting with a very high level of antibody, so if you're starting with a lower level and that's dropping off, and those antibodies aren't as effective at really attacking the spike protein of the Omicron variant, you're just going to have less of an effect overall from those vaccines. And that's the same for the J&J and the AstraZeneca, which is this somewhat not too much older technology. There's still great technology, but it was not producing these sky-high antibody levels as the mRNA vaccines were, the Pfizer and the Moderna vaccine. So that is primarily the thinking right now as to why those are not as effective. It could also be that some of the antibodies that are more of the antibodies that we would get from a J&J are less effective just as a functioning antibody. There's not enough information on that yet, but it does have to do a lot with how much antibody was originally produced from the vaccine. The thinking though is if you got a J&J and then you get the mRNA booster, you actually get just as strong a response as if you would have got the original series from the mRNA vaccine.
Excellent. Yeah, thank you for explaining that. Is there, last question is there any reason why that you could think of that Coconino County is getting hit with Omicron so much harder and quicker than the rest of the state?
Personally, Mr. Mayor and Council, I think that we are the cold spot of the state, and we have a lot more opportunity. We were set up right now, especially Thanksgiving through Christmas, for a lot more transmission because more people were celebrating, gathering indoors, huddling indoors. And then we see single-digit temperatures. There's less likely that people are just outside enjoying the fresh air. And so that together with Omicron coming in, it's just allowed it to spread so much more quickly. We don't have any epidemiologic reasons that I know of or can think of that would have put the county at higher risk for getting more Omicron originally coming in. I just think it comes in and then it spreads from there, and we were just set up for a lot more spread earlier on because of the colder temperatures in northern Arizona.
All right, thank you for that. Council, do we have any other questions at this time? Well, Dr. Engelthaler, I greatly appreciate, I know we all do, your knowledge and the research and information that you provide to us. It's invaluable, and we're very grateful to have you and your team here in Flagstaff able to help us navigate and better understand what we're dealing with here. And hopefully we won't have you back to have a variant discussion on rho, pi, sigma, and the rest of the alphabet. This is my real
Well,
hope.
maybe just omega. That would be the end of it, right?
There we go.
No, I appreciate it, and thank you all for your leadership, and always reach out if you need anything else.
Thank you.
Thank you, Dr. Engelthaler. Council, we just have a few more slides to share with you today to go over the data from Coconino County. I'll just start right with that slide. Oops, sorry, I hit the wrong one. So if we look at our COVID-19 weekly cases for week ending December 25th, we had 645 new cases reported, which is fairly similar to what we saw here in December last year. When we're looking at the geographic area, Flagstaff is still seeing the highest number of COVID cases, and we've seen an uptick for the last 2 weeks since the beginning of December. For hospitalizations, we had 24 for December 25th. Our 65 and older is still seeing the highest number of case admits for COVID itself. Our deaths here in Flagstaff are showing 4 for December 25th. We've been pretty static since the end of October, with 5 deaths per week, now seeing 6 deaths per week here in December. Our community transmission remains high. We had 455.9 per 100,000 as our case incident rate. We had 15.4% positivity, and our COVID-like illness is remained at 9.9%. Our community vaccination rates for Coconino County residents is currently at 68.8%. This is as of January 3rd, which compares to 66.5% for our last update, which was week ending November 27th. Our COVID variants, which we talked a lot about today, this report at the end of December was still showing majority Delta variant and the beginning of the Omicron variant at 72 samples. And those were seen in the month of December sampling. For our Northern Arizona Healthcare, they are reporting 46 positive patients, which is down from our last report at the December 7th meeting. We do still have 46 hospital beds that are available, which remains the same. And we now have 2 critical care beds available. And this data on the screen is from 8:15 on January 3rd. So just as a reminder, the hospital has explained that this data can sometimes change on an hourly basis. Those are all of the data points that we have to share with you today. I'm certainly happy to answer any questions that council might have.
Thank you, Deputy City Manager. Do we have any questions, Council? All right, I'm not seeing any of the.
Mayor, I do.
Oh, Councilmember Shimoni, yes.
Thank you, Mayor, and thank you, Deputy City Manager Anderson, for the update. So, we just heard from Dr. Engelthaler that, there's a lot that is in the pipeline heading our way. And we also obviously heard that this variant isn't likely going to increase death rate. But I'm just wondering, from the perspective of council meetings, in-person meetings, our staff, et cetera, is the city internally working on a plan to get us through the next 2-month window of time or month and a half window of time. I'm guessing this data is maybe also somewhat maybe new to our team as well, and I just want to make sure we're prepared for what's yet to come, and maybe not supporting the spread, but also, doing our duty. Maybe those plastic dividers between council members that do attend might be a benefit to the group. And I'm just wondering, have we had any of those discussions?
So Councilmember Shimoni, the city has remained in phase 3 of our reentry plan, which means that we're still limited opening, limited services in our city facilities. And just as recent as this last Monday, just continuing to remind staff to be able to work remotely in the cases where that is, that's available to them, and that it works to provide the service virtually. So we are continuing to do that in order to reduce the number of staff as well as visitors in our buildings. And we do require that individuals wear masks while inside our facilities as well as our vehicles. So I think our continuing of those requirements should help us in getting through the next, I think you had indicated the next 30 days.
Okay, yeah, 30 to 45 days is what Dr. Engelthaler was expecting the timeline to be. And then, with his comments regarding the type of mask and N95s fitted well, Mayor, I personally would recommend that we go back to a fully virtual reality as, to get through this period of time. And also maybe not ask our staff to meet folks in person unless it's like outdoors with masks on. Shannon, I trust your leadership and concern for staff's needs, but I'll just speak from, a member of council here. I'm very concerned about what's to come, and I know that it's not going to, potentially increase our death rate, but it might knock out our ability to operate in certain ways. And so that's likely going to happen. We're going to expect to see these numbers triple, if not, even more potentially in the next 2-3 weeks. So yeah, I guess those are my comments, Mayor. I know that this is our agenda item to talk about it. So council, if you do have any thoughts, I'd love to hear what you're thinking. But yeah, I'm concerned. Thank you.
Thank you, Councilmember Shimoni. Any other comments, questions? All right, I think, well, in regards to the proposal for Councilmember Shimoni saying that we should potentially go virtual, I think we're seeing here today I think that us as council members have been very responsible regarding our contacts, and we're all vaccinated. And just like you're staying home today, last week I stayed home because I had a known contact. So I do trust in my fellow council members, at least up here at the dais, that we are acting responsibly with this hybrid model. I would just encourage messaging to staff, et cetera, that similarly, if they got a scratch in the back of their throat, to please get tested, take some additional measures, stay home, whatever is required, and let's. I trust in the responsibility of us to be able to navigate that at the staff and elected level. With that being said, though, we may want to really start looking into the opportunity potentially for the city itself to be able to provide tests to its staff members. We've been having a rather large shortage. So many people couldn't find them at Walgreens or anywhere else during the holidays. They're still having difficulties. I know we're getting more of a shipment in from CCHHS with the state here soon, which I'm glad is going to be more available to us more generally, but in terms of as an organizational standpoint, it would be good if we could have a stock to supply to our employees in case they do have symptoms, just to be sure we're we're protecting our people here in the organization. So just a thought on that front. All right, aside from that, I do believe we are ready to move on. Thank you, Shannon, and thank you, Dr. Engelthaler, for the very informative COVID-19 update. Council liaison report.